Hi, I'm DrRic with a tutorial on vitamin D. Vitamin D is essential for every process that goes on in the body. It used to be considered a hormone because the body can produce it. The way the body produces it is to expose the skin to sunshine, and actually through a process that's chemical, you convert, through a couple steps, you actually make vitamin D. The problem is, especially with the scare of melanoma, skin cancers from the 70s and 80s, the sunbathing from the 70s and 80s, there was an uptick or a spike in cancers of the skin, and the Dermatology Association had decided to make sunscreens available. And now we have sunscreens that go up to very high SPF, and that'll be another talk or another tutorial in the future. But with the very high SPFs, if you do spend time in the sun, you'll certainly be blocked from developing skin cancers, but your vitamin D will not be converted. Sunlight will not be absorbed. So most people, especially those that live in Chicago, or actually any place north of Georgia, will have levels of vitamin D that are subtherapeutic. And I'll explain subtherapeutic. If you go get your blood test done at a lab, standard labs around my area in Arlington Heights, Illinois, the two local hospitals, Alexian Brothers and Northwest Community Hospital, in addition to Quest and other labs, will have levels registered as normal being within 30 to 100 nanograms per milliliter. Now don't worry about the units of measurement, but 30 to 100 is considered normal. At the Arizona Center for Integrative Medicine, we have looked at the research and determined that better levels of being therapeutic, or at least having a good vitamin D, would be 50 to 70. So the average person that comes into the office when I get cholesterol tests or when I look into whether they have anemia or problems with the liver, I'll include a vitamin D. And unfortunately, the majority of Americans that do come in, whether they work indoors or outdoors, have low levels. So we'll just go ahead and assume you have checked your own levels, or I've checked your levels and they're low. But what can we do about it? Number one, our goal is always 50 to 70. What I used to do if I found a low level was use a prescription pad and give what's covered by most insurances as far as a prescription vitamin D3. I did that for about a year, but I found it wasn't improving my patients, and I was wondering why. And one of my patients actually called up and found out it was not vitamin D3, it was vitamin D2. Ergocalciferol versus cholecalciferol. Cholecalciferol is animal-based and ergocalciferol is plant-based. When you look at the studies on absorption of vitamin D3, most people will absorb both of them, but there are some folks who can't absorb or will poorly absorb D2. And if Walgreens, nothing against the pharmacies, but if Walgreens, CVS, and Walmart pharmacies are giving D2, and I'm having to give unusual amounts, 50,000 international units once a week for, it's supposed to be 3 weeks, but if I have to give it more than 3 months, I'm sorry, it has to be 3 months to see an effective change, but if I have to give it for more than 3 months, 6 months, 12 months, then there's something wrong. And the first thing would be perhaps switching to vitamin D3 cholecalciferol. So, number one, make sure that you have D3. Number two, vitamin D is fat soluble. So if you're taking it on an empty stomach, the likelihood is low that it's going to be absorbed properly. If you're having problems with getting those levels, and usually your doctor should check you again in about 3 months of attempting a dietary change or a supplement change. If your numbers are still low after 3 months and it's on and you're on vitamin D3, try to take it with a fatty meal. Now, a fatty meal can be, I'm not saying animal processed fat, but fatty meal could be taking it with your omega-3 fish oil. Omega-3 fish oil is just great for everybody. Or krill, or flaxseed, if you have no other choice. But because vitamin D3 is fat soluble, it gets absorbed better when you take it with fat, meaning when you take it with your meal or when you take it with your omega-3 fish oil. So my usual suggestion is to do vitamin D twice a day with an omega-3 fish oil. To make it easy, I would say 1,000 international units of vitamin D3 twice a day with 1,000 milligrams of omega-3 fish oil if you don't have any problems with the fish oil. Krill oil is fine, a little more expensive, but that's also another talk. So again, we supplement if we find deficiency. If we don't find deficiency, then continue with what you're doing. Just be careful if you're relying on sun exposure. I think in the long run it's very good, it's healthy to get outside. Just like here, this is Bussey Woods South. It's close to my office. It's nice to get out in nature, but you always have to worry about melanoma, skin cancers, problems like that. And just because you are in the sun does not guarantee that you're going to be able to convert vitamin D3. So even my construction workers in the summertime, this is Chicago, so it's different from the sun of the equator or down in Florida. The true method of getting enough vitamin D sunshine is to expose 40%, that's 40% of your body to the sun, unblocked, between the hours of 10 and 2 or 10 and 3 for about 10 to 15 minutes. That supposedly gives your body, if you're functioning properly, about 10,000 international units of D. So those are the suggestions. Again, if you're going to be choosing not to take supplement because it's not affordable or you are outside in the sun a lot, please be careful about getting skin cancer checks annually or on a routine basis. And hopefully this does help with regards to vitamin D3, using it as a supplement and trying to get to maximum levels of nutrition. Follow me on Herbal 411 or come visit me in Arlington Heights, Illinois. This is Dr. Rick for your tutorial on vitamin D3. Thanks.